Okay. Thank you, Madam Chairman. Appreciate it very much. And I want to thank all of you for being here. Dr. Shukut, first of all, thank you for your service, many, many years of service. And I appreciate very much what you have done. And my first question would go to you because you probably have the historical knowledge of how we got to where we are. Over the last decade, the United States has lost over 50,000 public health jobs. And during that time, we have faced the H1N1 flu outbreak, Ebola, Zika, and now COVID. Within the last 5 years alone, West Virginia has lost nearly 30% of our public health workforce. One thing we know from this pandemic is that we were not prepared. While we have been able to hire temporary public health workers in the last years, these positions, they're not permanent and are at risk of disappearing after the health emergency is over. So can you speak to how we became so vulnerable and fell behind the curve in our ability to respond to this pandemic? And how can we keep it from not happening again? I know you all touched on it, but I just can't believe we were this unprepared.
Yeah, I think the state of our preparedness was a real tragedy, and part of that relates to the public health infrastructure. Over and over, we invest in response to a crisis, but in ways that haven't provided sustainable capacity at that front line where the problems happen.
Was these decisions made higher up within whoever the administration may have been, whether it's Republican or Democrat? Was it made at that level, or was it made at the head of the CDC?
The biggest funding increases we've gotten have been emergency funds from Congress that, happily supported response for H1N1 and Ebola and Zika and COVID. But the dollars that were there day in and day out to provide reliable jobs for that local public health workforce were not there. And whether it was state budgets or federal budgets, you cited the statistics of the job loss. Beyond that, the jobs aren't the same anymore. We talked about the data. Our data systems have really not kept up with the times. We have a very fragmented data systems that
Let me ask you, maybe
modernized.
My time is limited. I want to ask Dr. Walensky this question, but on this, Dr. Shukut, what type of a time basis would you say that we should be looking at for funding? I mean, to have confidence in the funding and permanent funding over a 5-year, 10-year period? So it's consistent, you know what you can do and be prepared?
I think the approach that was taken for NIH to strengthen their capacity for vital biomedical research is what needs to happen for the vital public health infrastructure in the country, where it's not a feast and famine, but that local, state, and federals can plan.
Well, now be the time to do it. If we're ever going to do it, we should do it now, since it's all very, very fresh in what we've been able to endure. Dr. Walensky, as you're aware, we're facing an epidemic with pandemic. West Virginia is ground zero for the drug epidemic, with the highest rate of drug overdose deaths in the country. To make matters worse, 2020 was the worst year yet, with over 90,000 deaths. We saw at least 47% increase in the state of West Virginia with overdose deaths. So what resources is CDC providing to states to combat the epidemic?
Thank you, Senator, for that question.
And also, a second part of that would be working on helping, what CDCs are working on helping increasing testing for viral hepatitis and HIV. We've had a tremendous, horrendous situation with that.
I can tell you, just before coming here, I spoke to one of my infectious disease colleagues in West Virginia, and she was telling me that they have opened neonatal detox units. I understand.
Unbelievable.
It's unbelievable. It's unbelievable. And so we know that we need to tackle this. We need to encounter this. We need accurate data. We need interventions that can, and we need resources to be able to invest in opioid naloxone programs that are reaching the community health workers that can do the outreach to talk to people and intervene at the local level where these are happening. We need toolkits. We need information and mental health support services to intervene.
My time's running out. I want to ask you one other thing. We produce very little of the things that we basically need for medicine. Penicillin, do you think penicillin should be produced in America? Do you think doxycycline should be produced, an antibiotic in America? And if so, what should we do in order to do that or stockpile strategically for our own protection?
I think we need to have a public health infrastructure and a pipeline that allows us to respond to pandemics and to epidemics and to infectious threats.
Do we have any manufacturers that are producing these in America?
There are limited manufacturers producing penicillin, that I can tell you, because in fact, we've had penicillin shortages. Penicillin has gotten extraordinarily expensive, and in fact, some colleagues of mine have once said it should be cheaper than the tubing it runs through, and in fact, it's not.
Should the CDC basically, I mean, your recommendation would be for production, we should be producing these in America. We just, we need to have something from a professional like yourself to get back to producing things in America, not depending on foreign supply chains.
So one of the things I can just mention for penicillin specifically is it's particularly hard, given the allergies related to penicillin. It's actually particularly hard to do. There are limited plants that make penicillin, but your point is well taken.
Thank you. Thank you, Madam Chairman.
Thank you. Senator Moran.